Beating depression using psychedelics. In recent years, the potential for psychedelics to treat depression has gained momentum as a promising alternative therapy. Depression is a widely prevalent mental health disorder that afflicts a vast number of individuals worldwide. Despite the existence of various treatment methods, including medication, psychotherapy, and lifestyle adjustments, many individuals still battle with their symptoms. This predicament has left patients seeking additional treatment options, including the use of psychedelics. Psychedelics encompass a class of drugs, including substances like psilocybin, which can be found in magic mushrooms, LSD, and ayahuasca, which induce profound changes in perception, mood, and thought. Although psychedelics have faced stigma and criminalization for decades, recent research suggests their therapeutic potential in addressing a range of mental health conditions, including depression. One primary mechanism by which psychedelics may aid in treating depression is by inducing a state of heightened psychological and emotional openness. Unlike traditional antidepressants that alter brain chemistry, psychedelics appear to work by increasing brain plasticity and promoting the growth of new neural connections. This can lead to a greater sense of perspective, heightened emotional awareness, and a deeper understanding of oneself and one's place in the world. Studies focusing on psilocybin, in particular, have demonstrated its effectiveness in treating depression. A 2016 study conducted by Johns Hopkins University revealed that psilocybin produced substantial reductions in depression and anxiety symptoms among patients with life-threatening cancer. Similarly, research by Imperial College London found that psilocybin therapy improved depression symptoms in patients who had not responded to traditional methods. Although the exact mechanism of action through which psilocybin and other psychedelics alleviate depression symptoms remains unclear, researchers believe it may be related to their ability to activate specific brain receptors, particularly the serotonin 2A receptor. This receptor plays a crucial role in mood regulation and is dysfunctional in individuals with depression. Certain psychedelic substances, such as psilocybin and MDMA, have shown promise as therapies for treatment-resistant depression and post-traumatic stress disorder. They appear to promote the growth of new connections between neurons in the brain, a phenomenon known as plasticity. Understanding the precise mechanisms through which these drugs encourage brain plasticity could pave the way for the development of related medications that promote this process without causing unwanted hallucinogenic effects. It is important to note that the use of psychedelics in treating depression is not without risks. Psychedelic experiences can be intense, overwhelming, and unpredictable, potentially triggering or exacerbating underlying mental health conditions. For this reason, any use of psychedelics should be conducted in a controlled, supervised setting under the guidance of trained professionals. In recent years, there has been a surge in interest in the clinical use of psychedelics, leading to the establishment of various organizations and research institutions dedicated to exploring their therapeutic potential. Despite promising results from research studies, significant legal and regulatory barriers impede the use of psychedelics in a clinical setting. Most psychedelics are classified as Schedule I drugs under the Controlled Substances Act, signifying their perceived lack of medical use and high potential for abuse. This classification makes it challenging for researchers to conduct clinical trials and for patients to access these treatments. Despite the difficulty of obtaining psychedelics for therapeutic use, more and more people are turning to this option as a potential solution to their depression symptoms. While further research is necessary to gain greater insight into how psychedelics can be used safely and effectively in treating mental health disorders, current evidence suggests that they may provide hope for those who have